Cluster headaches occur in cyclical patterns or clusters, which gives the condition its name. Cluster headache is one of the most painful types of headache. Please like, comment, share and subscribe. Thank you for your love and support. Cluster headache commonly awakens you in the middle of the night with intense pain in or around one eye on one side of your head. A cluster headache strikes quickly, usually without warning. Common signs and symptoms include excruciating pain, generally located in or around one eye, but may radiate to other areas of your face, head, neck and shoulders. One-sided pain. Restlessness. Excessive tearing. Redness in your eye on the affected side. Stuffy or runny nasal passage in your nostril on the affected side of your face. Sweaty, pale skin, pallor on your face. Swelling around your eye on the affected side of your face. Drooping eyelid. The pain of a cluster headache is often described as sharp, penetrating or burning. People with this condition say that the pain feels like a hot poker being stuck in the eye or that the eye is being pushed out of its socket. The exact cause of cluster headaches is unknown, but abnormalities in the hypothalamus likely play a role. Cluster attacks usually occur with clock-like regularity during a 24-hour day, and the cycle of cluster periods often follows the seasons of the year. These patterns suggest that the body's biological clock is involved. In humans, the biological clock is located in the hypothalamus, which lies deep in the center of your brain. Abnormalities of the hypothalamus may explain the timing and cyclical nature of cluster headache. Imaging studies have detected increased activity in the hypothalamus during the course of a cluster headache. Unlike migraine and tension headache, cluster headache generally isn't associated with triggers, such as foods, hormonal changes or stress. Some people experience an aura or nausea similar to those experienced with migraine headaches. Once a cluster period begins, however, consumption of alcohol can quickly trigger a splitting headache. For this reason, many people with cluster headache avoid alcohol for the duration of a cluster period. Other possible triggers include the use of medications such as nitroglycerin, a drug used to treat heart disease. There's no cure for cluster headaches. The goal of treatment is to decrease the severity of pain, shorten the headache period and prevent the attacks. Because the pain of a cluster headache comes on suddenly and may subside within a short time, cluster headache can be difficult to evaluate and treat, as it requires fast-acting medications. Some types of acute medication can provide some pain relief quickly. Based on the latest studies, the therapies listed below have proved to be most effective for acute and preventive treatment of cluster headache. Acute treatments. Fast-acting treatments available from your doctor include oxygen. Briefly inhaling 100% oxygen through a mask at a minimum rate of at least 12 liters a minute provides dramatic relief for most who use it. The effects of this safe, inexpensive procedure can be felt within 15 minutes. The major drawback of oxygen is the need to carry an oxygen cylinder and regulator with you, which can make the treatment inconvenient and inaccessible at times. Small, portable units are available, but some people still find them impractical. Triptans. The injectable form of sumatriptan, Amitrix, which is commonly used to treat migraine, is also an effective treatment for acute cluster headache. The first injection may be given while under medical observation. Some people may benefit from using sumatriptan in nasal spray form, but for most people this isn't as effective as an injection and it may take longer to work. Sumatriptan isn't recommended if you have uncontrolled high blood pressure or heart disease. Another trypan medication, zomitriptan (Zomig), can be taken in nasal spray or tablet form for relief of cluster headache. This medication may be an option if you can't tolerate other forms of fast-acting treatments. Octreotide. Octreotide, sandostatin, an injectable synthetic version of the brain hormone somatostatin, is an effective treatment for cluster headache. Local anesthetics. The numbing effect of local anesthetics, such as lidocaine, xylocaine, may be effective against cluster headache pain in some people when given through the nose, intranasal. Dihydroergotamine. The intravenous form of dihydroergotamine, DHE45, may be an effective pain reliever for some people with cluster headache. This medication is also available in an inhaled, intranasal form called Migranal, but this form hasn't been proved to be effective. To have the medication administered through a vein, intravenously, you'll need to go to a hospital or doctor's office to have the medication administered through a vein, intravenously. Preventive treatments. Preventive therapy starts at the onset of the cluster episode with the goal of suppressing attacks. Determining which medicine to use often depends on the length and regularity of your episodes. Under the guidance of your doctor, the drugs can be tapered off once the expected length of the cluster episode ends. Calcium channel blockers. The calcium channel blocking agent verapamil, Kaline, Veerlen, others, is often the first choice for preventing cluster headache. Verapamil is often used in conjunction with other medications. Occasionally, longer-term use is needed to manage chronic cluster headache. Side effects may include constipation, nausea, fatigue, swelling of the ankles and low blood pressure. Corticosteroids. Inflammation-suppressing drugs called corticosteroids, such as prednisone, are fast-acting preventive medications that may be effective for many people with cluster headaches. Your doctor may prescribe corticosteroids if your cluster headache condition has only recently started or if you have a pattern of brief cluster periods and long remissions. Although corticosteroids may often be a good short-term option, serious side effects such as diabetes, hypertension and cataracts make them inappropriate for long-term use. Lithium carbonate. Lithium carbonate, which is used to treat bipolar disorder, may be effective in preventing chronic cluster headache if other medications haven't prevented cluster headaches. Side effects include tremor, increased thirst and diarrhea. Your doctor can adjust the dosage to minimize side effects. While you're taking this medication, your blood will be checked regularly for the development of more serious side effects, such as kidney damage. Nerve block. Injecting a numbing agent, anesthetic, and corticosteroid into the area around the occipital nerve, located at the back of your head, may help improve chronic cluster headaches. An occipital nerve block may be useful for temporary relief until long-term preventive medications take effect. Ergots. Ergotamine, available as a tablet that you place under your tongue, can be taken before bed to prevent nighttime attacks. Self-injected dihydroergotamine (DHE45) also may be helpful. Ergot medications may be effective if taken early in your cluster attacks, but they can't be combined with triptans and can only be used for brief periods of time. Melatonin. Studies show that 10 mg of melatonin taken in the evening might reduce the frequency of cluster headache. Other preventive medications used for cluster headache include anti-seizure medications such as Devalproex, Depakote, and Topiramate, Topamax. Surgery. Rarely, doctors may recommend surgery for people with chronic cluster headache who don't find relief with aggressive treatment or who can't tolerate the medications or their side effects.